Good afternoon, and welcome to this session. My name is Dr. Joan Reed, and I'm Dean for Culture and Community Engagement and Professor of Medicine at Harvard Medical School, Professor in the Department of Social and Behavioral Sciences at Harvard T.H. Chan School of Public Health. And I have the privilege of being the director of both the Commonwealth Fund Fellowship in Health Policy Leadership at Harvard University and the Joseph L. Henry Oral Health Fellowship in Health Policy Leadership. So thank you for joining us for this informational webinar for the Joseph Henry Fellowship. Before we begin the webinar, I want to share with you the statement on mutual respect and public discourse at Harvard Medical School to set a tone for our mutually supportive community in terms of what you hear, questions that might be asked, and the way we interact with one another. There are also some housekeeping items. This webinar is being recorded and will be made available on the fellowship website. All lines are muted, but the chat is also not available. Live closed captioning is available, and you can turn that on. You can submit your questions using the Q&A function within this webinar. The program this afternoon includes an overview of the fellowship program and the application process, and will be followed by current and alumni fellows sharing their experiences, and will conclude with a Q&A, an opportunity for you to ask any questions. Our speakers today include current fellow Dr. Raymond Dawkins, Joseph Henry alum fellow Dr. Shelley Taylor Shoatan, and Commonwealth Fund Fellowship alum Dr. Mary Fleming. But first, I'm going to provide an overview of the fellowship program. There are three main goals of this fellowship. The first is to create oral health leaders who will pursue careers in multiple spheres: health policy, public health practice, and academia. It's to prepare leaders who will, over time, improve the capacity of our healthcare system to help address the health needs of all, with an emphasis on disadvantaged, vulnerable, and uninsured populations. And third, to support the continued career development and advancement of our alumni fellows in ways that enhance existing and create new resources to improve communication, function, utilization, and meaningful actions of our alumni network. A little bit about our fellowship history. The oral health program was initiated in 2001 through the support of HRSA, DHHS, and the California Endowment. And in 2005, the program was renamed as a Joseph L. Henry Oral Health Fellowship in Health Policy to continue the amazing legacy of Dr. Joe Henry in serving to provide resources for the next generation of leaders in health and health policy, particularly as they relate to oral health. Some of the outcomes to date: there have been 15 oral health fellows, and post-fellowship, 67% are in the private sector, 20% in academia, and 13% in the public sector. Almost 3/4 of the alumni serve on committees at local, state levels. 33% or a third have received honors and other awards, and a third have also published their work, but all are engaged in policy, research, service delivery related to marginalized populations. In terms of the overview and eligibility, fellows must be dentists with a DDS or DMD degree and an active dental license. Completion of residency or at least 1 year of experience in practice is preferred. It's not required, but preferred. And experience or interest in addressing and improving the health needs of all, with that emphasis on disadvantaged, vulnerable, and uninsured populations, is also emphasized. We're also looking for strong evidence of leadership experience or potential, and U.S. citizenship or U.S. permanent residency is a requirement. In terms of benefits, there are many: full tuition, health insurance, books, travel, and related program expenses, including financial assistance for practicum projects, and importantly, a network of fellows, alumni fellows and current fellows that you'll be able to work with. An overview of the program: there are 2 degrees, an MPH at the Harvard T.H. Chan School of Public Health or an MPA at the Harvard Kennedy School for those who already hold an MPH. For the School of Public Health, there are 2 fields of study, health management or health policy, but there's Harvard class cross-registration across all of our Harvard faculties, say from the Kennedy School or Business School or Education School. And the 2025-26 academic year will be in person. There will be some virtual activities, but it is an in-person fellowship. You see listed here some of the course requirements, such as biostatistics, epidemiology, health systems policy, finance, economics. There's seminars in leadership, programs in decision analysis, healthcare quality, innovation, and time to take elective credits also. There are also, in addition to the coursework, fellowship activities, there's leadership forums, special programs on leadership skill development, seminar series, journal club, op-ed writing workshops. There is a practicum that's a requirement of the fellowship as well as a requirement of the MPH program, and it's one practicum that fits both requirements. Mentoring is available on multiple levels. And there are group and individual meetings with the program director and associate program director. Fellows attend national conferences. There's a leadership day with members of the leadership from the Harvard community and Mass General Brigham. There are site visits, both local and national. There are shadowing of leaders. And then there is a health policy annual meeting that includes current fellows, but also brings together alumni fellows. Some of the ways of thinking about the fellowship activities are offering an opportunity to build your own personal narrative, expanding your career networks, and fostering an understanding of systems and how systems interact, connecting leadership and with leadership and policy programs locally and nationally, and strengthening alumni connections. In terms of how to apply to the program, the application deadline is December 1st, 2025. And for the 2 programs, the School of Public Health and the Kennedy School programs, require application to each of those programs, and admission into the fellowship requires being accepted by the Kennedy School or the School of Public Health. So there are 2 acceptances, either to one of those 2 schools and to the fellowship in order to be able to attend. You see here the phone number for inquiry, 617-432-2922, as well as the email if you have any questions. And some examples of the career paths by the past fellows. You can find part of this online. You see individuals who are dentists in practices, chief health officers, the pediatric dentists, individuals who own their own consulting firms, heads of dental centers, the dental director for Franciscan Children's, orthodontists, individuals who work with the federal government in multiple capacities. So there are alumni who work on multiple fronts, from public to private sector, each finding their own path and course towards leadership. And now an opportunity to be able to hear from both current and alumni fellows. And our first is Raymond Dawkins, who is a current oral health fellow in our program. Dr. Dawkins.
All right, greetings, everyone. My name is Raymond Dawkins. I'm the current Joseph L. Henry Fellow. Just to give you a little bit of background about myself, I'm originally from Alabama, which is where I completed dental school. I came up to the Northeast for my pediatric dental residency at Yale. I finished in 2022, and afterwards I decided to move to New York City. I practiced in the metropolitan area for just under 3 years before leaving clinical practice to pursue this fellowship. I feel like this opportunity came at the right time in my life. Um, in practice, I began to feel like I could be doing more. I had gotten pretty comfortable and proficient with working with my patient population, but the day to day just started to feel like a little bit repetitive. I didn't feel like I was growing in the right direction, well, the direction I wanted to grow in. And I've always had like other interests outside of clinical dentistry, particularly in public health, reaching a broader population, advocacy. I've had interest in teaching and just becoming um, academically active. And so uh, it was difficult for me to kind of explore those areas in the setting that I was in. So I saw this fellowship as a chance to intentionally focus on those interests and to develop ways to extend beyond clinical care. I actually remember watching this webinar last year, and it really hyped me up to apply. And I did, and surprisingly ended up working out. And now that I'm currently immersed in this fellowship, I can honestly say that has exceeded my expectations. Dr. Reed and her team has done an amazing job designing the program. She is very thoughtful and intentional about leadership development, and everything we do is connected to our long-term professional goals and the impact that we can have on these vulnerable populations that we are pledging to serve. Um, Being a part of the Harvard community has been amazing experience. I've been learning so much, meeting incredible people from all over the world. I'm finding myself in rooms and in conversations that I've never imagined that I would be a part of. Doors are opening in ways that I couldn't have expected. I've only been here for 5 months, and I've already feel like my life has opened in so many ways. There's just so much opportunity here, and you can truly shape your experience into something special. On top of that, I'm surrounded by an incredible group of co-fellows who we share a common purpose, and we've quickly become like family. One of my co-fellows actually just got married in DC this past weekend, and a good amount of us were able to go down and celebrate together. So I think that just kind of speaks to the type of community that this program fosters. So if you're interested in making a broader impact, exploring your professional interests outside of clinical dentistry, if you want to grow personally, professionally, I couldn't recommend this fellowship enough. And if you're uncertain on the fence about applying, I think it was helpful for me to actually start the application because it's pretty lengthy, but working through the questions, I think it kind of helped me to wrap my head around everything, and it kind of solidified my reasons for doing it. And so I felt like that was helpful. So thank you.
Thank you. Thank you very much, Ray. We also have with us an alum of the Joe Henry Fellowship, Dr. Shelley Taylor Shoatan, who's Institute Dental Director of the Institute for Family Health in New York, and advisor and clinical subject matter expert for CareQuest Institute for Oral Health.
Hi, good afternoon, everyone. So I'm really excited to be part of this webinar. When Jackie messaged me about the webinar, I told her I need to rearrange my schedule because this fellowship is so personal to me, and I see how this fellowship has helped me propel myself in my career. So just a little bit of background information about me. I'm a dentist. I specialize in periodontics. So I'm a specialist, and I focus on gum health and bone health within within the mouth. And prior to this fellowship, I was a dental director in Florida and also in Massachusetts. And I felt stuck in my career. I felt that I was only affecting my community at my health center, and I really wanted to help my community broader, like outside of my health center, within my community. And I wanted the tools to be able to assist my community and make positive, effective change. And this fellowship, a word that was used during my fellowship was serendipity. And I randomly went to a retirement party, and that's where I met Dr. Swan. And I was just explaining to Dr. Swan, I didn't know him at the time, how I felt stuck in my career. And I really want to make change. I want to help my community. I want to help the under-resourced population, but I'm not sure how. And he mentioned that he's a Joe Henry Fellow. And I asked him, what is a Joe Henry Fellow? Tell me more. And he explained everything to me. And that's when I looked online and I saw the application was open. So I applied and I got accepted. And that was the point in my life that changed. It pivoted my career that in ways that I could not even imagine. So it opened my eyes and taught me how to effectively make positive change within my community, how to read data, and how to communicate data to key stakeholders within my health center, to my patients, and helping me understand how data can move change. Understanding how to read data and understanding how to communicate data could help change. And also it helped me like analyze financial documents. So as a leader in the health center, we have to understand finances. And so this fellowship gave me the foundation. So now I feel comfortable talking to our chief financial officer and explaining what we need to do, making budgets. I just feel confident in rooms that I didn't feel comfortable before. And I think the fellowship afforded me that opportunity. And also the fellowship, so there was a large network of fellows, both the Commonwealth Fellows and also the Joe Henry Fellows that I still use today. Dr. Swan, I speak to him about once a month. There's another fellow, Dr. Hodge. I talk to her often. When I was going through the interview process, we did mock interviews. It's a family, and it's just so much support in the fellowship that I'm just so proud and so happy that I have this group of individuals surrounding me, and I'm also part of this group as well. And as a result of the fellowship, I was able to do complete my goal of just not only focusing on my one health center, but focusing nationwide. I speak at different conventions across the nation about oral health and the importance of medical and dental integration. I'm a consultant for one of the largest dental nonprofits in the U.S., and that's only because of the fellowship. I wouldn't have known about these opportunities without the fellowship, and I don't think I would have pushed myself without the fellowship and without the leaders within the fellowship telling me, yes, you can do it. You can do it. This is your goal. Apply. Keep going. And I just want to end by saying that in my fellowship, I wanted a position where I can focus on medical dental integration within the health system and focus on bettering the health of the community. And with my job right now, I have dental clinics in upstate New York, Manhattan, and school-based health centers. And that is something that I wanted to do. I'm reaching New York, and I wouldn't have been able to reach so many individuals in New York without this fellowship. So I think if you're interested in the fellowship, apply. And like Dr. Dawkins said, like the application process is long. You have a lot of essays, but use that as like a reflection and then to help solidify why this fellowship is important to yourself and also to the community.
Thank you, Shelley. Thank you. And the last presenter is Dr. Mary Fleming, who is a Commonwealth Fund Fellow from the class of 2011. She is president of the Reed Scholars, and she can tell you more about what that is. And she's the director of leadership development to advance equity in healthcare, which is part of the Harvard Executive Leadership Institute. Dr. Fleming.
Thank you so much, Dr. Reed. It's a pleasure to be here with such good company. I like Shelley said, anytime you get that call from Ying or Jackie or Dr. Reed to participate in something, you figure out how to make it work. And so, as you might notice, I am on call. I am in scrubs, but I wanted to be here, so hopefully we don't get interrupted. I would like to echo a few things that have been said throughout the beginning. This is definitely a family affair. My origin story with the fellowship is I knew a fellow in the class when I was applying and called him. And if you matriculate into the fellowship, you'll meet Alden Landry. And he was like, you have to do this. It will change your life. It'll be the best year of your life. And without a doubt, that was the truth. It has been, as people have mentioned, very pivotal, not just in the didactic and academic part of the fellowship, but in the relationships that we formed over the course of the year. So these are just a few pictures from my actual fellowship year with my cohort, both in academic settings when we were on a site visit and were able to meet Martin Luther King III. Of course, we were in Boston, so we had to go to Fenway. We went out for fireworks. We traveled to New York to concerts together. We had chili cook-offs. That's a picture in my apartment. And, you know, we really spent a lot of time together, which was, you would think sometimes it'd be too much, but we really did like each other. We studied together. We fellowshiped together. We traveled together, and it was a wonderful bonding experience. We also went to weddings together. One of our cohorts got married that year, or the year after, and we went to her wedding. And so our relationships continue. These are still people I call on, talk to frequently, and you have that bond that's going to help you in your personal and professional development as you travel to your next point of your journey. As Dr. Reed mentioned, the other part of what I do as an alumni is the Reed Scholar. So I feel like I'm a fellow who just didn't want to leave, and so I figured out how not to do that and started participating in the Reed Scholars. So the Reed Scholars is the alumni network of both the Joseph L. Henry Fellowship and the Commonwealth Fund Fellowship in Minority Health Policy. And we, as you know, are all physicians and dentists who are collectively and individually working towards health equity across the country. And even we have some international work among us as well. We are a nonprofit. We were incorporated in 2010. And we have several signature events that bring us together both virtually and in person. So our annual Health Equity Symposium takes place in Boston in person every year except during the few years that we won't name right now. And we really work hard, as Shelley mentioned, around medical and oral health integration, because we think that that's very important, and it's also very unique that we have the opportunity to do that within our fellowship. We are leaders by nature, and we want to both develop our leadership skills outside of the alumni network, but also as building blocks within the organization to continue to help us grow. We, of course, have our business and board meetings. We try to make those as convenient as possible. Our business meetings are usually virtual. And our board meetings, we try to coincide with other national meetings like the American Public Health Association meeting, which is the next week in the recording of this video. A few years ago, we started Reed Scholars Live, which is an interactive podcast where we focus on health equity issues broadly. As you'll learn, I can make anything into a health equity issue because most things are. And so I really enjoy talking with people and hosting a broad range of guests to speak to various clinical, non-clinical issues as they relate to health equity. And we also we're really intentional about building these relationships. And so we do have social hours, at least 3 to 4 a year with the current fellows. We invite one of the alumni fellows to host, and all alumni fellows are invited to attend. And we want to help answer any questions. We talk about practicum, we talk about networking, we talk about finding a job, right? So even this fellowship is wonderful, but it's only 1 year and we have to go and do something great when we leave. And so we try our best to help facilitate those kind of questions and relieve any angst that there may be throughout the year. On these pictures, you will notice this is some pictures from our leadership retreats, from dinners. I try to, as president, I try to come and have an in-person dinner each year with our current fellows and of course our symposium. I too invite you all to apply. This will be a pivotal year. If you have any questions, you can always reach out to, I know most fellows, so feel free to reach out to me and I can always get you in contact with somebody if you have questions about application or what to expect during the fellowship, or if your experience is applicable for the year. But thank you all for taking the time to watch this and participate, and good luck on the next step of your journey.
Thank you very much. Thank you. You've heard from three enthusiastic individuals who've participated, are currently participating, or have participated in the fellowship program. And particularly for this, the Joseph L. Henry Oral Health Fellowship program in health leadership. And it's what you might call sister program, the Commonwealth Fund Fellowship in Health Policy Leadership, both leadership programs to prepare individuals to really head systems of care. As we enter this next part, I really want to open it up if there are any questions from those who are participating and joining us for this session. I will start out with one as I'm waiting, and you can put the questions into the Q&A. But I would ask from the three of you to just speak a little bit about this as being a full-time fellowship and what that might mean in terms of time, from the summer time to the time during the academic year, or sometimes asked, is there some free time to be able to do some clinical? And why don't we start with you, Ray, and then you, Shelley?
So yes, so it is a full-time fellowship. The summer especially, you're not gonna have time to do anything else but class in the fellowship. You're gonna be taking biostats and epidemiology. Basically really 4 classes in the summer, and you're going to take those within a 6-week time frame. And so it's just a lot of information that you're going to have to process and deal with and learn within that time frame. So I don't recommend doing anything, outside of the fellowship during that time frame from July to maybe like the end of August. I personally, I do work clinically. I work like a couple of days a week. I do like a Friday, every Friday and a half day, depending on like what the fellowship schedule is. In the past, that's not has been something that's common. Most of the fellows that I've talked with in the past, they didn't work, but I just decided to work to keep up my clinical skills as I'm trying to go into academia. So
Thank you, Shelley.
Yes, like Greg said, the summer is intense. And so the summer is really difficult to do any activity outside of the fellowship because we are heavily in the didactic classes. But I was a dental director during the fellowship, but my employer was very flexible. So I was able to reduce my clinical time and have more administrative time towards like the class or the biostats and those type of classes that we had. And for me, what worked out was what I was learning in the fellowship, I was able to apply in my practice as a dental director. So I thought that was really exciting. But definitely for the first 6 weeks, I think it was up until August or September, there was not a lot of time outside of the fellowship. It's very, very didactically heavy.
I would say with that, because both Ray and Shelley have talked about it being didactically heavy. It is. You're getting 10 of the 45 credits for in the summertime towards your degree for the MPH program. At the same time, it frees you up to be able to take some electives and do some other things and have practicum time during the rest of the academic year. And I think it's fair to say there's a good deal of bonding. You're not isolated during that time. The fellows really work very closely together. I mean, Mary, you've seen many classes of fellows. Maybe you can give your take on part of that transition into the fellowship. And people transition in. It's hard to go back to school. But your take on that, and maybe doing other work while in the fellowship.
Yeah, well, one of these things are not like the other. So I'm an OBGYN. So I was excited about having a year off of clinical work. And so I really enjoyed it. And I think those who can, I think it's worthwhile to have that break and really be able to focus on the work at hand, because it's intense, but it's fun. And you don't get another year like that. So I think it's to take the break off. And And for me, my clinical skills were just fine when I got done. I didn't feel like I missed much taking the year off. I would agree with Ray, though. I think, thinking about over the course of all of the fellows I've interacted with, the general sense is most people take the time off and are full time in the academic setting. There are those who will do, for those shift workers who can do a shift in the ER once or twice a month, people may do that if you can pick up something like that, or a half a day of office work or clinic work. For those, especially those who were in Boston already, right? It was kind of easier. I think if you're moving to a new city, it's probably a little bit more difficult to pick up work like that. But I think most people do not regret taking the time off and away from clinical work if they.
Thank you. One of the questions we've been asked in the past talks about, if you think about from the MPH side, not the MPA, but the MPH side, how is this different than just getting an MPH? Why would you do this as opposed to getting an MPH? This is extra work. Ray, Shelley, Mary?
Oh yeah, so I think so. Starting the program, you can tell it was very very different for the fellows versus like kind of the other people at the other students in the MPH program, meaning that we already kind of had like a community of people to kind of share, common values and purpose with, and I think getting MPH by itself is fine and all, but the fellowship kind of brings everything to life. We're speaking with numerous speakers from all aspects of healthcare, working on things kind of related to helping those in vulnerable populations, and the fellowship kind of helps the educational experience become targeted in that way, and it kind of helps us to develop and as leaders and professionals, public health professionals, and the future directors of healthcare organizations or whatever career path you're trying to get to. I think the fellowship kind of cultivates that and kind of is basically a home incubator to create leaders who are going to go out and implement the changes that we need.
Shelley and Mary, anything you want to
I
add?
can go next. I think one of the things, and to echo Ray again, is one of the few times you are with a group of people that are like-minded and uplifting. And so it just amplifies the experience that it would be different than if you were just another student in an MPH program. I think the other part of the program, and how I always describe it, is it's the MPH is actually the extra, right? The leadership program, and what Dr. Reed cultivates is the beauty of the program. And I think for me, it opened the doors to possibilities that I never even knew existed. And so Ray alluded to these extra sessions that you have during the year. And so you meet with leaders in so many aspects of healthcare leadership that are just phenomenal. And traditional medical and dental training is not going to get you there. Regular MPH training is not going to get you there. You have a resource in Dr. Reed that is unmatched across the country, and I would probably say worldwide. And so being able to have access to that network and understanding, like what Shelley was saying earlier, understanding what the steps are to fulfill your dreams is something you won't get anywhere else.
Yes, and when I was looking for an MPH program, I was drawn to the MPH program at Harvard and also the fellowship because it was oral health. And when I, when I was looking at the other MPH programs, I would always ask the question, how can I relate this to the practice of dentistry? Is there any courses, any leaders in this MPH program that could assist me with my goals of medical dental integration? And sometimes the answers were no, but you can be that person. But at the time, I wasn't ready. I needed the mentorship. I needed the leaders within the fellowship to help guide me, who are still guiding me in my career path. So I think the fellowship it's just amazing because yes, we get the MPH, but the fellowship is where the power is made. Like this is where you're becoming the leader through the fellowship.
Thank you. Thank you. one of the questions that came in, is there just one fellowship slot a year? There is normally or usually just one Joe Henry Fellow a year. This year, there are actually two, and it's because one person split it over a 2-year period of time and the others for 1 year. It's normally a 1-year fellowship, but we will look at individual circumstances, and sometimes it can be split into 2 years. But normally there's one fellow per year. I think those are the end of those questions. It sounds daunting. I would say that I really like this idea of completing the application. I think it's a time to reflect of why would you want the fellowship? What is it that you want to do with this? And where do you want to take this in your career? It's helpful to answer those questions for not just for the application, but for yourself. Of, is this right for you? And is this program right for you? I want to thank you for joining us for this webinar today. I hope you found it informative, and I hope we see your applications. I want to say to Shelley, Mary, Ray, thank you very much for joining, and thank you for your input. Have a good day.